Did you know that small changes in your pee or a little swelling around your ankles can be the first signs that your kidneys are getting weak? Hi, I am Dr. Cristina Morato. I work with people facing chronic conditions and I explain medical things in plain language so you can act early. First, a clear warning. There is no miracle tea. There is no miracle cure. What I will give you are practical facts, signs to watch for, the tests your doctor should order, and simple steps you can take today to protect your kidneys. Stick around, subscribe if you want more straightforward health tips, and share this with someone who drinks painkillers often or has high blood pressure. Now let us start by understanding what the kidney actually does in everyday terms and why tiny changes matter. The kidney is not just an internal filter. It is like a pair of vigilant housekeepers that clean your blood, balance fluids, control minerals that keep your bones and heart steady, and even help activate vitamin D so your bones stay strong. Imagine a water treatment plant in your body. The kidneys filter out waste like urea and excess creatinine. They regulate how much salt and water you keep so your blood pressure stays stable, and they stop proteins from leaking into the urine. When they fail to do these jobs, the consequences reach far beyond the bladder. You can picture the kidney as a soft organ the color of a dark walnut tucked under your ribs, working quietly while you sleep, hearing the faint hum of your heartbeat and the subtle rhythm of your breathing. You may feel nothing at first, then notice subtle clues like a metallic taste in your mouth, a persistent tiredness like wearing wet clothes, or a smell of ammonia when you open the bathroom door. If you feel lost about what to look for, pause here and take a breath. If this topic worries you, that is normal. Many people only pay attention when swelling appears or tests are already abnormal. Tell me in the comments, have you ever noticed swelling, foamy urine, or sudden cramps? Type yes and which one, or no if you have not seen any signs. Your short comment helps others know they are not alone and helps me choose what to explain next. Sharing your experience in a single word takes seconds, and it supports the community. Thank you for speaking up. Now back to the story so you know exactly what those words mean and what to do next. So what is renal insufficiency, simply put? Renal insufficiency, or kidney failure, means the kidneys cannot filter blood well enough to keep the body balanced. There are two broad situations to know: an acute problem that happens fast, like a sudden drop in blood flow after heavy dehydration or a bad reaction to a medicine, and a chronic, slow decline over months to years, often linked to diabetes or long. High blood pressure. Acute renal failure can sometimes be reversed if the cause is found and treated quickly. Chronic kidney disease tends to progress slowly and may be managed to delay worsening, but often does not fully reverse. Think of acute as a fridge that suddenly stops because the plug was pulled, and chronic as a refrigerator with worn parts that slowly lose efficiency. Now imagine a short scene in the clinic to make this concrete. Sarah sits on the exam bed, the paper under her knees is crinkly, and the room smells faintly of antiseptic and coffee. Dr. Patel checks her notes and speaks calmly. Sarah says quietly, "I have been so tired and my ankles are puffy." Dr. Patel replies, "When did you first notice the swelling?" Sarah answers, "A few weeks ago, mostly at night." Nurse Lisa leans in, touching Sarah's wrist, and says, "Your blood pressure feels high today. Did you check it at home?" Dr. Patel answers, "We will ask for blood tests and a urinalysis today, and I want you to bring a list of medicines." Sarah asks, "Could this be my ibuprofen?" Dr. Patel says, "Non-steroidal anti-inflammatory drugs can harm kidneys if used a lot, so we will review that." This short exchange shows how simple questions reveal important clues. In that scene, you could hear the soft tick of a clock, see a pale window light, smell hand sanitizer, feel the cool stethoscope on the skin, and notice the rough paper under the legs. Those sensory details matter because illness is experienced with senses as much as with numbers. Let us be clear about the main jobs of the kidney so you know why changes in urine, fatigue, or blood pressure matter. First, filtration. Kidneys filter waste products from the blood, including urea and creatinine, those lab names you may already have heard. Second, fluid balance.
They decide how much water you keep so you do not swell or get too dehydrated. Third, mineral control. They keep sodium, potassium, and calcium in the right range and activate vitamin D, which affects bones and muscles. Fourth, hormone support. Kidneys release substances that help control blood pressure and stimulate red blood cell production. When these functions fall, you may see protein in the urine, called proteinuria, changes in urine output like polyuria or oliguria, or experience high blood pressure that is hard to control. Now let us discuss the difference between acute and chronic in a bit more detail. So you know expectations. Acute kidney injury may follow a severe infection, a drop in blood volume after surgery, or taking high doses of certain medicines like anti-inflammatory drugs or some antibiotics. If caught quickly by a nephrologist and treated with fluids, stopping the offending medicine and close monitoring, many people recover most of their kidney function. Chronic kidney disease is usually a slow, steady process caused by long-standing diabetes, prolonged high blood pressure, or recurrent kidney stones and infections.
In chronic cases, the kidney tissue becomes scarred, and while progression can be slowed by controlling blood sugar, blood pressure, and avoiding toxins, there may be irreversible loss over time. Think of acute as a sudden bruise and chronic as slow wear and tear. What causes weakened kidneys and which of these causes you can actually change? Major contributors include uncontrolled high blood pressure, diabetes, frequent use of nonsteroidal anti-inflammatory drugs such as ibuprofen or naproxen, repeated urinary infections, kidney stones that obstruct flow, certain autoimmune diseases, and some over-the-counter supplements that are not regulated. Lifestyle matters. Dehydration, excess salt, a diet with too much processed food, and smoking all increase risk. I will name a few people to make it relatable. Miguel, a construction worker who drank little water during long hot shifts. Anna, who relied on over-the-counter pain pills for chronic back pain. Mark, who had diabetes and let his blood sugar run high for years. Priya, who had recurrent urinary infections and delayed evaluation, and Jose, who used herbal products that contained contaminants. Each person shows a different avoidable path to kidney trouble. In real life, you can often change what you do. Stop excessive painkillers, manage diabetes, treat infections early, and hydrate sensibly. Now, let us look at the symptoms and signs you can notice at home, in detail and with sensory examples so you know what to watch. Start with urine changes. Foamy or bubbly urine often feels slippery in the bowl and can mean proteinuria. Darker or tea-colored urine may look like strong coffee and have a slightly sharp smell. Less urine than usual or very little flow, oliguria, can make you press harder when you pee and notice a dry mouth and sticky taste. Polyuria, frequent large volumes, can wake you at night and leave you dragging through the day. Swelling or edema feels like tight shoes. Your rings may cut into your fingers, and pressing your thumb into your shin can leave a temporary dent. Fatigue is common and may feel like walking through cotton or carrying an invisible weight on your chest. Cramps, especially at night, are sharp and wake you from sleep. You may have persistent nausea or a bitter metallic taste that ruins the flavor of food. Skin changes can be dry, flaky, or develop small bruises. Breath can take on a urine-like or chemical smell when waste builds up. Hearing the low, steady beep of a clinic monitor, seeing pale gums, and feeling cool palms are subtle signs your body is trying to tell you something. If you recognize one or more of these changes, what exams should you ask for and what actions are urgent? The basics are simple. A urinalysis, often called urine type 1, looks for blood and protein and can be done quickly. Blood tests for urea and creatinine tell how well the kidneys are clearing waste. A 24-hour urine may measure protein loss. The simple test suggests proteinuria. Check your blood pressure often and report values consistently above target. An ultrasound of the kidneys can show obstruction, stones, or size changes. Avoid self-medication, particularly non-steroidal anti-inflammatory drugs, and avoid starting unregulated herbal supplements without a discussion. If you have sudden severe changes, very low urine output, swelling with shortness of breath, confusion, or very high potassium on labs, seek urgent care or the emergency department. Dialogue again to illustrate escalation.
Sara returns with Mark, who is worried. Mark asks, "How fast can this get worse?" Dr. Patel answers, "It depends on the cause, sometimes overnight, but often over weeks." Sara asks, "What will the tests show?" Nurse Lisa says, "We will look at creatinine and urea trends and your urine." Dr. Patel adds, "If values are very abnormal, we may hospitalize you for close monitoring or start dialysis, like hemodialysis, to support you while we treat the cause." That scene includes the clinical, chairs, the sharp scent of antiseptic, the cool touch of a blood pressure cuff, and the tinny ping of a lab printer. Prevention and practical tips you can use today are powerful because they give you control. Drink water regularly so your urine is pale straw-colored rather than deep amber, unless you have a medical reason to restrict fluids. Keep blood pressure under control and aim for targets your doctor sets, usually below 130/80 for many at risk. Manage blood sugar carefully if you have diabetes. Avoid routine use of anti-inflammatory pills for aches. Talk to a clinician about safer options. Watch for urinary infections and treat them early. Reduce salt, avoid crash diets, and be cautious with supplements. Get basic tests yearly if you have diabetes, high blood pressure, or a family history of kidney disease. If you are advised to see a nephrologist, do not delay. Before I close, a clear, practical checklist. If you notice persistent swelling, foamy urine, reduction in urine output, unexplained fatigue or cramps, or if your blood pressure is hard to control, schedule a urinalysis and blood test for creatinine and urea and ask about a 24-hour urine if protein is detected. Control the controllables: water, blood pressure, sugar, and avoid excess non-steroidal anti-inflammatory use. If this video helped, subscribe to the channel for more straight talk about signs you can see at home and what tests to ask for. Share this with someone who takes painkillers frequently or has diabetes. Remember, knowledge is power and early action matters. Catch kidney problems early, treat the causes you can change, and protect your future.